Hi and welcome to my channel. So if you are a healthcare professional from Zimbabwe right now, whether you're a nurse, you're a social worker, you're a doctor, you're a carer, whatever healthcare role you've got, this is a very challenging time for you because 2023 has been a very catastrophic year, for healthcare professionals in Zimbabwe with some of the laws that have been. The recent and the most significant one is that Zimbabwe's vice president, who also happens to double up as the health minister, and that is Honorable Chiwenga Constantino, has indeed announced that he is going to criminalize the recruitment of all healthcare professionals from Zimbabwe to work overseas. This is something that it is a very powerful statement to make, and it's going to have a huge impact, massive consequences on all healthcare professionals currently in Zimbabwe. And that's why I always say, if you've got plans, for example, to move, you need to do that immediately because the laws are always changing and you never know which way those laws are going to be. So if you're watching this and you're new to my channel, look, you're welcome. In this video, I'm going to be telling you what this means for healthcare professionals in Zimbabwe, what the Zimbabwe government's plans are, what this means if you're already in the UK as a healthcare professional over from Zimbabwe, and what has prompted all of these discussions, what the impact of this is going to be, and what you should do immediately in order to salvage yourself from this catastrophe that is going to be befalling everybody, all of us really, because it is a very sad situation. So if you're new to my channel, look, you're welcome. If you're a returning subscriber, I appreciate your time, and I do hope that this information is helpful for you and it should help you to act, adequately and make sure that you're adjusting your plans with every news that you find out. So if you haven't subscribed to my channel, you do want to hit subscribe right now. Turn on the notification button so you're the first to be notified every single time when I drop a new video on here. Because look, I'm all about bringing you the latest opportunities in the UK, the easiest and the most cost-effective and timely ways that you can move to the UK with visa sponsorship opportunities, career progression pathways in the UK, side business opportunities in the UK that you can do to earn a lot more money so that you can retire early without working until you literally drop, as well as work from home opportunities that you can do from the comfort of your own home worldwide without those geographical boundaries. So if you're keen on any of this information, look, you want to check the comment section below. I've got a newsletter on there. When you join my newsletter, it's a free newsletter. Once you join that newsletter, I'm going to send that information directly to your inbox so that you never miss out on any important information, any vital information that is going to play such a massive role to your personal and professional development here in this beautiful country, the UK. So it's not going to take you up to 20 seconds to join that newsletter. You simply drop your name and your email and you're part of the newsletter. I'll send that info directly to your inbox, so you're not reliant on the YouTube algorithm, which, look, we never know how it's going. So like I was saying, Zimbabwe's vice president, who is also the country's health minister, has announced that they're going to criminalize recruitment of all healthcare professionals from Zimbabwe. So basically, beginning of this year, in fact, that was last month, Zimbabwe was added to the World Health Organization's shortage occupation list. What this means is that as of now, it is now illegal for recruitment agencies to recruit any healthcare professional whatsoever from Zimbabwe. Look, when I heard this, I was like, oh my God, this is terrible news. But there's even worse news, because beginning of this year as well, 2023, that was in January. In fact, previously, there's been so many strikes over in Zimbabwe. There's been, and by the way, in case you're watching this actually and you're wondering who I am, so my name is Melvis. I currently work as an advanced nurse practitioner here in England, in the UK. So I work for the NHS as an advanced nurse practitioner. I moved to the UK myself. I was a carer working in a nursing home, and then I've studied here as an international student, and then I've progressed beautifully in my career to now working as an advanced nurse practitioner, which is the most senior clinical nursing position, that you can have in the profession. So career progression is something that I'm really passionate about. So I support nurses, carers, student nurses, students, prospective student nurses, people that want to move to the UK with visa sponsorship opportunities. I support with all of these through my private coaching program, which is called Nursing Career Bootcamp. If you check the About section of this YouTube channel, you're going to see a link to my private coaching program. And when you join, I'm going to support you to make sure that you get that tailored, that individualized, that personalized support that you need and deserve to be able to move to the UK ASAP without spending thousands of pounds and you're doing that promptly. Also, if you're already in the UK, I support with career progression. If you're a nurse, for example, or a midwife, and you want to progress, how do you become a nurse manager? How do you become an advanced nurse practitioner? How do you become a nurse anesthetist? How do you become a specialist nurse? You want to start your own side business. How do you go about that? Work from home jobs that you can do. How do you go about all of that? If you're a carer, and you're keen on getting into nursing, progressing into clinical, non-clinical healthcare jobs, look, I can support you with all of that. If you are looking for visa sponsorship opportunities to move to the UK, whether as a nurse, as a healthcare professional, as a carer, again, I can support you with that journey, give you that tailored, that individualized, and that personalized support that you deserve. Because look, YouTube videos like this are good to watch, but the truth is that they don't have that tailored information. I don't know who's watching this video, so the information I'm giving is very generic. But if you want us to look at your personal circumstances and say, look, this is who you are, this is what you've got right now, what is the best pathway for you, especially with all these changes that are ongoing, you want to make hay while the sun shines. So if you need that support, please, you do want to check out my private coaching program so that we get started immediately, because things are constantly changing, whether here in the UK or out in other countries. So basically, what has the minister said with regards to recruitment? The minister has said that it is unethical, it is illegal for countries like the UK, for example, to continue to recruit healthcare professionals from Zimbabwe, a country where, they are struggling and they barely have enough nurses and doctors to care for their own people. And basically, he said that people are dying in the hospital because they don't have healthcare professionals to care for them. And what is happening is that those healthcare professionals are moving overseas. But look, let me tell you, last year, the capital city of Harare over in Zimbabwe, they reported that quite a few hospitals had to close because they didn't have enough staff, because healthcare professionals had moved to the UK. They also announced that some hospitals over in Harare, which is the capital city of Zimbabwe, the hospitals were struggling, clinics to recruit healthcare professionals. Some also reported that many of their senior nurses are actually the people that moved to the UK, because the truth is that many of these colleagues that moved to the UK are people that are already like ward managers. They are really senior, experienced professionals. So when they leave, there's a massive gap that they leave in the country. And so the minister is saying that it is ethically, morally, and legally wrong to continue to recruit these people. And so they are going to put a law in Zimbabwe. The government in Zimbabwe is going to make it a criminal offense to recruit any healthcare professionals. What this means is that it is going to become impossible for healthcare professionals in Zimbabwe to leave the country. And look, there's been a massive response to this, obviously, as you can imagine, because the Doctors Association in Zimbabwe, has spoken out, obviously, and said that it is because of, the low pay, the poor working conditions, and that's why people are forced to leave the country. It's not because they want to leave, but it's because they feel forced to leave. And obviously, the local media has also reported that there are 3,500 doctors in Zimbabwe for about 16 million people. So if you look at that, obviously, that will kind of justify why the healthcare, the World Health Organization has now added Zimbabwe on the red list. When you look at nurses, 2.6 nurses are, will care for about 1,000 patients in Zimbabwe. Again, of the total population, that again is a very, very low number. It's a very staggering number. And again, they have reported that in a very short period of time, about 4,000 nurses and doctors have left Zimbabwe, with majority coming to the UK, attracted by the high pay in the UK, better working conditions, even though nurses, and healthcare professionals in the UK are also striking, but the conditions in the UK are so much better than those over in Zimbabwe, which again, the colleagues that have moved, to other countries like the US of A, Australia, Canada from Zimbabwe, they're all saying they didn't move because they wanted to, it's because they kind of felt forced to. And by the way, if you're enjoying this content, I want you to like the video. If you haven't subscribed to the channel, you want to subscribe to the channel, let me know that you enjoy content like this, obviously, and I should do more. Because look, news like this, you need to act on it. While it may not be the type of news that you're going to embrace and be happy about, but you need to be informed. And that is why I make sure that I share news like this to you, because I can see the government actually changing this and making it a criminal offense, and that's going to make it impossible to recruit any healthcare professionals. What this means is that if you're currently already in the UK or in Canada, US of A, Australia, from Zimbabwe, that's fine. You've already moved. that's okay. But if you're still in the country, you must move immediately if that is your plan, obviously, because once these laws are passed, it's going to become impossible to leave the country. Again, the Doctors Association in Zimbabwe has said that according to the laws of the country and human rights, every single citizen in Zimbabwe has the right to move freely within the country, and they also have the right to move freely out of the country if they so wish. And that is going to become a human rights issue if the country actually sets such laws for healthcare professionals. But again, we know that politics is very powerful, politicians are very powerful, and they have a huge impact on our futures, as workers. In the UK, for example, strikes are currently ongoing because politicians wouldn't increase the pay. If they had increased the pay, this would not be happening. And so sometimes when people say that healthcare professionals should stay out of politics, I'm like, look, you don't know what you're talking about. Because as healthcare professionals, we must be interested in politics. As many of us have to get involved with politics so that you can have that impact, because you understand what the challenges are. Many of these politicians do not understand what the challenges are with healthcare professionals, whether in the UK, whether in Africa, it's all the same everywhere. But the more you involve in politics, the more you're going to know and the more impact you're going to have, because obviously everybody has spoken out. There's been huge disappointments, even on social media, with colleagues from Zimbabwe saying, look, if things had been going well in the country, we would never have left. And to make matters worse, in January this year, that's 2023, the government over in Zimbabwe passed a law saying that it is illegal for healthcare workers and healthcare professionals to strike for more than 3 days. This is because there's been ongoing strikes in the country over in Zimbabwe, because of low pay and poor working conditions. So now it's become illegal to strike for more than 3 days, because obviously it's not going to be a criminal offense. But at the same time, the government has actually said that they don't have the funds, they don't have the finance to be able to increase the pay for healthcare professionals, and they don't also have money to improve on the infrastructure and buy more equipment. So it's like, well, you don't have money for this, so what should the healthcare professionals do? It is a massive, massive challenge, and I can see why colleagues are leaving, because like me, for example, if I could progress in my own country, if I had the opportunities that I now have in the UK, if I had them in my own country, I probably would not be here. So it is for the same reasons that all of us are moving to the UK, better opportunities, not only for ourselves, but for our families. And the fun thing is that these African politicians, they never have healthcare actually in the country when they're unwell, both themselves, and their families. They always travel overseas so that they can get that first class healthcare. But then the poor citizens in the country don't have access to the funds to travel overseas and get healthcare. So it is also ethically, morally, and legally wrong, everything that is happening. But again, who am I? What do I know? What can I say? So please, you need to make hay while the sun shines. If you're watching this and you've got colleagues from Zimbabwe, you're watching this and you're from Zimbabwe, colleagues back home, you need to share with them so that, if you need IELTS, for example, don't be scared of IELTS. If you're a nurse, you're a doctor, get your exams done. Find opportunities that are going to be better, not only for you, but for your, kids as well. And that is the reason why all of us are traveling. Because when you look at the numbers, for example, and what the World Health Organization said regarding adding Zimbabwe onto the red list, they said that COVID-19 has had a huge impact, on the, in the country, obviously. And the recruitment of healthcare professionals has been massive over the last 2 years, which means that if it carries on, there's going to be a depletion of healthcare professionals. And I remember when I shared this on my Facebook page, which is Nurse Melvis Career Coaching, some colleagues from Zimbabwe were like, hey, Melvis, this didn't happen. Hospitals didn't close. It's all politics. It's not true. I'm here working in the country. I didn't see any news like this. Look, we all know that politics is very powerful. We know that the media is very powerful, whether we agree with what they're reporting or not. The reality of it is that when they report those things, they do have an impact, and the impact is only going to be felt by the common people, by the local people like you and I. So again, if you haven't joined my newsletter, you want to check the comment section below, drop your name and email, and you're going to be part of that newsletter. If you've got any personal questions that you want to ask, and you're thinking, oh my God, Melvis, I don't want to put this over on YouTube, but I've got this question, please do use that newsletter as well. Otherwise, leave all your questions in the comment section below, and I'm going to be able to answer those questions. I'm going to provide more information that I've got regarding this, because obviously I do follow healthcare changes, healthcare law, healthcare practice really keenly across the world. world, Africa, most especially, as an African, as well as the UK, particularly because obviously I'm resident in the UK and this is where I also practice. So again, if you need that support with your career progression, securing visa sponsorship jobs, you want to take a step further in your career, you don't want to stay stuck in the same position, again, get in contact with me. Check out my private coaching program, Nursing Career Bootcamp. If you check the About section of this YouTube channel, you're also going to find lots of free resources that I've got for you. Interview preparation, how do you write your CV, how do you present yourself, what are the factors that are going to influence and impact on your career progression as a healthcare professional. Also, I've recently had other people who are not necessarily healthcare professionals join the program, for example, like teachers. Zimbabwe is one of the countries where teachers can be recruited from, and there is an amazing pathway currently ongoing for teachers to be recruited over from Zimbabwe as well as other countries as well. So if you're keen on any of these pathways to secure visa sponsorship in the UK, free visa sponsorship so that you're not spending thousands of pounds without being sure of what you're getting, then again, you should consider getting in contact with me. But most importantly, you can apply for those jobs, if you're moving to the UK, because there's never been a better time to move to the UK than now. There are more pathways to move to the UK right now than there's ever been in the history of this country. And look, many of these pathways don't even require you to have IELTS, and I've done all sorts of videos about all different pathways that you can use today to move to the UK, which means that if you're in a country like Zimbabwe, for example, and you're thinking, oh my God, how long is it going to take for me to write IELTS? How long is it going to be? By the time I finish that, maybe this law would have been passed. Look, there are many other pathways that you don't need a degree and you don't also need IELTS. Non-clinical healthcare jobs that are very highly paid. You're going to earn from £34,000 for some of these jobs and above, far more than you would even earn as a nurse or a doctor in the UK. So you want to be smart, you want to be vigilant, you want to make sure you're making the most of the best opportunities in this country while the opportunities are still there. Because if this law is passed over in Zimbabwe, look, it is going to become impossible for healthcare professionals to move. And look, that is very sad, because for me, it's the freedom of choice, is the fact that you should have the freedom to be able to find a better life for yourself, to be able to change, to say, look, I want to do this. If it is criminalized, it is going to become impossible. Already, as we speak, some colleagues have had issues getting the nursing council to provide that verification. And look, the government, there are many ways that the government can actually implement changes to stop healthcare professionals from moving, because that third-party verification that is normally needed by the General Medical Council in the UK, as well as the Nursing and Midwifery Council, they can stop, the countries back home or those as organizations back home from giving that verification. And if they stop that, then it's impossible to move to the UK and do those jobs, and that is not going to be good. So please, you want to make sure you're sharing this with your friends, with your colleagues, your family, with your loved ones, so that they are aware of this news. It's a brand new change. So massive changes happening in Zimbabwe. First, it was the fact that it's now illegal to strike for more than 3 days, even though the government has said they don't have the funds to increase the pay or improve the infrastructure. The second is that Zimbabwe has now been added to the red list, which means it is now illegal for, recruitment agencies to recruit healthcare professionals from Zimbabwe. The third is going to now become a criminal offense to recruit healthcare professionals from Zimbabwe at all. So again, these are massive changes. I empathize with colleagues in this beautiful country, and I do hope that you find a way out of this situation. If you've got any questions, please leave them in the comment section below. I'm going to join you there, and if I find any more information, I'll 100% share with you. And do take this seriously, because you just never know when these laws will come to force. Because like I say, politicians are very powerful. They are very, very, very capable of making really catastrophic changes that are going to have a huge impact on our lives as ordinary people. Many of whom will never really get to experience some of these consequences, and may never even get to understand the impact that these laws have on the lives of the citizens, on the lives of the common people like you and I. So all you can do is make sure that you're racking in, the chances for success, to make sure that you are doing what you can to salvage yourself before the situation gets a lot worse. So again, if you haven't joined my newsletter, check the comment section below and do make sure that you join If you haven't subscribed to the channel, you do want to hit subscribe right now. Turn on the notification button so you're the first to be notified when I drop a new video on here. But most importantly, if you need my support, consider joining my private coaching program where you're going to get that individualized, that personalized, and that tailored support that you deserve in order to achieve all your UK career goals. Share this with any colleagues that you have so that they may benefit from it, and check out other videos that I've done on this channel about all sorts of pathways to move to the UK. What is the best pathway to move to the UK right now? How do you do that? What are the requirements? You know, what are the other jobs that are providing visa sponsorship to move to the UK? You're going to see all of those on this channel. You know, what are the jobs that do not require arts to move to the UK? Again, I have done all of those on this channel. How can you move to the UK in 3 to 5 weeks? Again, I've done lots of videos on that on this channel. So please, you want to check out those opportunities. And again, if you've got any questions, please leave them in the comment section below. I'm going to join you there and answer those questions for you, because I understand that emotions are going to be running high. This is not the best news that any of us expect, but the reality of it is that we must know what is going on within our sector so that you can act accordingly and make hay while the sun shines. Like I always say, time waits for nobody. If you don't know what's going on, ignorance is not any reason why you're going to say, oh no, I didn't know about these, Melvis. And that's why I dedicate my time to do this research and bring out all this information to you so that you never miss out on anything that is going on. It doesn't matter where it is, as long as it's relevant to, you know, nurses, for example, carers, midwives, healthcare professionals, moving to the UK, working in the UK, having a beautiful life in the UK. These are all things that I'm interested in. So again, you know, if you join my program, there's that holistic support that you get to make sure that, you know, you get that all round, you know, experience that you need to have. If you're already in the UK, obviously from this country, Zimbabwe, congratulations, you're not going to be affected by this, but it's your colleagues that are still back home that are going to be affected by these new laws and these new changes. And so we do hope that the government does not go ahead with this law, but it is very likely that they will, because the minister was like, definitely it's got to go ahead as soon as possible. So again, thank you for watching. I'll see you in the next video. Bye for now. Keep watching the videos.